For us in this area, rural health disparities are huge all over the country, all over the world, really. What is the model that we use for rural America? Who are the trusted messengers? It's such a heterogeneous population that, how do we build that trust? I think you have to start with a piece of it that you can make a difference. Sometimes they call it low-hanging fruit. I mean, it sounds cliche, but I think that it's important because you can organize people around that. And you hope that it keeps spiraling bigger, rippling, I guess we could say. I am from Eland, Wisconsin, population 200, which is about 30 miles east of Wausau. Was there until I went to college, came here, went 2 years in Wausau, went 2 years to Marquette University in Milwaukee. I went to medical school at Washington University in St. Louis, and then I did my family medicine residency in Duluth, Minnesota. So I'd been moving around different places, and I think it's really important to see different parts. When I came back, I just couldn't hop into the same practice that I had been in, and it really did open my eyes to think about, like, what is the bigger picture here? How can I be present for a patient in the room, but also be present for what's going on outside of this room and in the community? Our mission here as a medical school is to try to train physicians that are going to help improve the health of central and northern Wisconsin. We know that kids from rural areas tend to be more likely to want to work in a rural area. But we also know that people that have connections, whether it be through where they grew up, or that's even part of the physician in the community piece too. If we get them engaged in the community where they feel connected, they maybe want to come back here. Connections and relationships, that's why, I'm here, but I think that's the key to helping us, really get a great group of young new doctors in this area. So much of what determines health is beyond healthcare itself. Basically, the zip code that you're born into sometimes has more to do with what your eventual health will be. The Wausau Free Clinic was an effort by a local physician who saw a need for providing health care for homeless individuals. One of our medical students actually was involved from the beginning, and she did some research about what kind of problems were people needing to be seen for. And then the next year's students started looking at, do people at the warming shelter have health insurance, and do they need a free clinic, or why wouldn't they seek it in other places? And it turns out that the majority of homeless people or people that were patronizing the warming shelter actually had insurance. When they opened it up to the public, it very rapidly became known that the majority of the uninsured people here in this area are the undocumented. So they have absolutely no access to health insurance, whether to try to purchase it through programs as far as Badger Care, unless they're pregnant, and they don't have access to many programs at all. In clinic and hospital settings, you can kind of get in your walls. So I think it's really good for the students to be able to just witness a different type of medicine. I hope that we as a society decide that healthcare is a basic human right, and that everybody should have access to basic health care. I don't think that that's unattainable. It's improbable in our country at this point in time. I think that most developed nations in the world have figured it out in some way, shape, or form. And I would be the first to say there's not any such thing as a perfect system anywhere. But I think we could do a much better job. The students that we have here that are graduating, they're enthusiastic, they want to care for people, They want to have a better world. They want to, they're brilliant. I would love to encourage them to, really collectively work together with their communities to change how healthcare is delivered.